Respected President Rotarian Mani, Secretary Ismail, members of Rotary Club of Coimbatore, members of the Sister Club Rotarians, Rotarians, Annettes, invited guests, and some of the real inspiring leaders of the city of Coimbatore, Manita Mohan Madam, Dr. SVK Sir, the Dean, Professor Kotur Sir, and Dr. R.V. Ramani of Shankara Hospital, Padma Shri, Dr. R.V. Ramani Sir, and friends of our institution and doctors from across the country. I deem it a great privilege to deliver this talk on one of the most important aspect of everybody's life, which occupies our mind every minute. It's indeed great that the Rotary International President chose the theme Rotary Opens Opportunities for the year 2021. He urges Rotarians to create opportunities that strengthens their leadership, help put service ideas into action, and improve the lives of those in need. I think never before we have been challenged like what we have been challenged today. So we need to open several opportunities to make sure the world is a safer and better place to live. So positive living strategies in this pandemic. During the course of this talk, I thought I am going to enumerate, though you would have read so many times, I would enumerate the symptoms and do we need to get afraid, when we should go to a doctor, and then what are the strategies that we need to adopt to make sure that we emerge successful after the pandemic is over, and how is that we can prevent decrease in the death rate and the mortality because of this disease. Just wanted to make sure, is the audio comfortable, sir? Is it audible? Yeah.
Yes, doctor.
Thank you, sir.
Yeah.
Thank you. I bring to you greetings from the institution where I work, the Ganga Medical Center and Hospital, Coimbatore. And the most important challenge that this virus, the COVID-19, presented to the human race is because of the fact that compared to the previous COVID virus, the SARS virus which happened before, the virus usually multiplied in the lower part of the lung. So the ability for a person to communicate to another person and infect another person was very less. Whereas this virus is in the upper respiratory tract, and because it multiplies there, and when you speak and communicate, when you cough, when you sneeze, it moves away from one person to another person. And because the globe became a village, we call the whole world as a global village because of the ability to go from one place to another because of the aircrafts which are available in plenty. What should have been an endemic disease became a pandemic in no time. And most of the countries thought that it was like a normal flu, and adequate precautions were not taken, and hence even the best of the best countries with great health infrastructure are facing a huge crisis, and lot of deaths have happened in the most developed nations. Now, if you introspect, the challenge that has been posed is extraordinary. This is an extraordinary challenge, but also you understand, if we do ordinary things with extraordinary discipline, you can defeat this virus. And the ordinary things that we need to do, which is inclusive of physical distancing with strict discipline, hand hygiene, and wearing a mask. I think these three things, though it has been repeated several times by several forums, still the human mind does not accept it, and we don't follow this discipline. In majority of them do not follow this discipline across the globe, giving the opportunity for the virus to thrive very well in the human race. So I would wanted to re-emphasize the extraordinary challenge can be defeated by doing ordinary things with extraordinary discipline. Tomorrow, we are sure, is going to be very different from what the world we lived in. And we need to reframe our thoughts today to create a future which will be akin to what we used to live before. So our lives have been divided into AC and BC, like before Corona and after Corona. But I strongly believe that the brilliance of a human mind can defeat the enormous amount of challenge that has been posed by this virus. This is a very beautiful anecdote which I wanted to give to all the people here. Your house is a castle. Your office is a castle. Your institution is a castle. And in olden days, if this castle has to be protected from a foreign invasion or by an enemy, you need to enhance your defense process. And this is the beautiful example that I borrowed from the institution MD Anderson Cancer Center in Houston, Texas. This is one of the largest hospital in the world, which offers the best cancer therapy, including major surgical procedures. Houston, Texas is having a great number of cases of COVID. There is a big upsurge, but you need to believe, because they kept their castle so fortified, every day 10,000 people enter this hospital. They have put their systems in place in such a nice way that they did not stop the elective surgical procedures. They kept continuing the elective surgical procedures, and they allowed 10,000 people to enter the castle, but made sure that neither the patient nor the healthcare worker got infected because of the virus. This is such a positive thing that has happened in one part of the world, when most of the institutions or most of the hospitals were shut down and closed. Here was an institution which continued to work with extraordinary discipline. And because they thought cancer patients need to undergo surgery and you cannot postpone it months together because they lose their life. This is in spite of the fact that a cancer patients who are on chemotherapy are more prone for infection because of they are immunocompromised. In spite of that, they continued. So which clearly indicates that each one of us, our homes, our institutions, the places where we live in, can be protected like the castle, like what they did in MD Anderson. And I'm going to share with you a few of those points. So we at the Ganga Hospital is similar to MD Anderson in that we are a major trauma center. So we keep getting injuries. I'm happy to share that in the lockdown period of April, we operated roughly 600 surgeries. And in the month of May, we started our elective procedures and we operated close to 1,400 surgeries. Similarly, in June, we had a big number of surgeries, like roughly about 1,400 surgeries. And we need to evolve strategies. So to protect a castle in the olden days, they said you deepen the moat, the big ditch or the canal which runs around so the enemy cannot invade. Narrow the drawbridge, close all the entrances. MD Anderson had 30 entrances for the 10,000 people to enter, which came down to 8 entrances and completely guarded. And also restock the alligator and you protect your castle. And I think each one of us can do this. And the way to do it is that until this pandemic is over, I strongly urge you will not invite anyone to come to your house. No socializing of any nature. You think that he is my best friend, he is in good health, why not he visit us? The relatives coming to your house, you say that he's my brother, he's my sister, my co-brother, co-sister, they're all in good health. Why should not they come to the house? I think we need to resist this, and we should not get any person new into the house. This is like deepening the moat, decreasing the number of visitors who are coming inside, and the house helps that you come. I think it's a great idea, like what we do in the hospital. You should make sure that the temperature is monitored. I would suggest that all the Rotarians can afford to get the non-touch, the temperature monitor, which you can have. I wish and I request all of you in the places where you work that you will do it. But even at home, you need to do for all the security guard, everyone who is going to come inside your castle has to be screened for temperature, and even the slightest temperature, they have to go home. And if they have any symptoms of cough, cold, you have to tell them that they should not come to work. This is something extremely important. When you go out and come into the house, I think it is mandatory that you take a bath in the hot water before you touch any objects. Did the lockdown benefit India? To a great extent, yes. The lockdown gave us the power to decrease the spread of the disease initially. India did remarkably well for the 1.4 billion population we have. But for the lockdown, we would have had so many deaths in this country by now. This allowed us to create an awareness in the community. We gained, as a medical professionals, we gained time to learn about the disease. The disease, the way we treat the disease has completely changed. The drugs that we used has completely changed. The way we used to ventilate the patient when they go into respiratory failure has completely changed now. I'm very happy to say that mortality or the death rate has been decreased because we have learned the new ways of ventilating this patient. We have got drugs like the steroid drugs like dexamethasone, anticoagulant drugs which will prevent the bloods from clotting in the pulmonaries, and the antiviral agent remdesivir. All this seem to have extremely helped us in decreasing the death due to this disease. Had we not put the lockdown, we did not know all these drugs, and the death rate would have been extremely high. We have also started having better equipments and a greater infrastructure for a country which did not spend much of its GDP for the development of health. But thanks to this, the infrastructure has improved, and the ability to take care of the poorest of the poor also is possible now. And it's been a time that all the healthcare workers, apart the doctors, were educated. So I'm very happy that our government took the decision of a lockdown for a long time. Though it produced an economic crisis, it decided that a human life is more important than the economy. And the most important thing is for the country is to have the human individuals to survive this pandemic. Even though if the economy is taking the back foot, I am sure we can come with a greater power the minute the pandemic is over and regain all the economic losses. But gone was that phase of lockdown. At one point of time, we had to open, and the concerns have been quite significant. There is a huge surge of cases now. And what was confined to few parts of the country has become a part of most of the cities. Initially, it hit the major cities. Then it went to the second and the third tier cities. And now it is slowly going into the peripheral areas of big cities. And there has always been a question whether the community spread has started. In all probability, yes. And the biggest problem of the disease is increased number of asymptomatic carriers. So one good part of the disease is if 100 people get infected, almost 85 to 90 people will not have any major symptoms. So this is the good part of the disease. But they are carriers for the viral from one place to the other. So this is the biggest challenge. So the good part of it is 100 people get an infection, 100 people get COVID positive. 90 people have no problem, no issues, no medicines to be given. But the 10 people, the rest of the 10, 5 of them become very good with simple medications, and less than 5% end up in an intensive care unit. So of the 100, 95 people, there are no issues. The problem is just to the rest of the 5% of individual. But I'm also happy to share, compared to the rest of the world, the mortality which is happening to the number of infected cases is still less in this country. Maybe it is because of the viral strain, or maybe we have learned to deal with it better. But the challenge is, considering the Indian population, the number of intensive care unit beds that are available is the only concern that we have now when the surge is going high. So we'll come to it a bit later. So now the single most important point that is in our mind is, will I get infected? Will my family members will get infected? And what are the measures that I need to religiously follow? And what are the guidelines that needs to be adopted? All of us know this. The spread is mainly because of the droplet infection and the micro and the macro droplet. And currently the United States has come with another theory saying that it's airborne. But this infection which spreads by the droplets or the airborne infection can be taken care by simple measures and protocols. As all of you know, this is very important. And hand wash. And second is, this is truly the most important thing that we need to do. Coimbatore city the prevalence was very mild 10 days ago. So it was enough to wear a cloth mask. But we have now gone from mild prevalence to moderate prevalence. So initially when it is a mild prevalence, the cloth mask was fine. But now we have gone to moderate prevalence where the community spread has happened. And it is very important that when you step out of the house, you have to go for a 3-ply surgical mask. This is very important take-home message, which I would wanted to give to all the members of the Rotary Club, that please stock a 3-ply surgical mask. And when you go outside, I request all of you to wear, and it has to be discarded. It is disposable. And I also wanted to tell you the simple way of wearing this mask and the best way of wearing this mask. It has got 3 layers, an outer layer and an inner layer, and there is a middle layer, which is the filter. So the outer layer, when you buy this mask, I would request you to ask the medical shop people, which is the outer side and which is the inner side. Because the outer side will, if a water droplet falls on the outer side, it will not absorb the droplet. But if you wear the mask, the opposite side, suppose the inner side becomes the outer side, then all the droplets which are coming in gets absorbed into the mask. So it's important to even know the simple step of wearing a mask appropriately to protect ourselves from the virus. So the outer layer prevents the droplet from getting absorbed. There is a filter in between, and there is an inner layer, which is an absorbable one. The sweat and some secretions which comes out in your face are absorbed by that. So this is something which, a take-home message, which I would wanted to give all the non-medical fellow Rotarians about wearing a 3-ply surgical mask. No more cloth masks for the city of Coimbatore or in those cities where you live in, where the incidence and prevalence is very high. Suppose because of work pressure, any of you have to travel or any of you have to go to a place which is crowded, I would strongly advocate that you need to go in a coverall suit. I wish that all the Rotarians, this is freely available now, and I would request that all of you will go on to buy a coverall to protect yourself whenever the next 6 months. So this is the next question, how long? So now approximately we have about 60 to 80 cases per day in the city of Coimbatore. It is expected to peak from July 15th, and it will supposed to be in the peak for another 3 to 4 weeks after that. That means up to August 15th, where they expect the surge to be approximately 250 to 300 cases, positive cases every day. According to the Center of Disease Control, for every positive case that is detected, there are going to be another 10 cases which are positive. Suppose if it is 300 positives that are reported, there are 3,000 cases in the community that you live in. So this is the biggest concern, and every day 3,000 gets added. So huge number of people will be getting infected in the month of July and August in the city of Coimbatore. And hence, it is important that you know all these steps and never think that you will never get infected. And I don't want all of you to think that it's okay, I'm just going to a friend's place, I'm going to a Rotary board meeting, so nothing will happen to me, because those people who are coming there are having good health. I would strongly advocate that this shouldn't be inside. Now, what are the predictions of this pandemic? The predictions of the pandemic are, so there is going to, for example, the city of Coimbatore is going to have a prediction as big surge between July 15th to August 15th. Then slowly it will taper down. And September seems to be a better month. And if the vaccine, which is supposed to be released on the August 15th, if it is really available, it is of good quality, and if its efficacy is good, then really we will be the luckiest of all to get a vaccine shot, and we will prevent the biggest surge which the Indian Council of Medical Research predicts, a huge surge in the end of October and beginning of November. To ward it off, if we have the vaccine in time and if it's effective, that will be the biggest boon to the mankind and to this part of the world. So I am sure, and I'm very, very hopeful and optimistic that this Covaxin produced by Bharat Biotech will definitely, it has entered into human trial, and I'm very, very hopeful that will help us and will become the biggest weapon to defeat this disease. I would also at this juncture suggest all the doctors who are present here, please stock the drug Remdesivir, the antiviral drug, in every hospital where you are working, so that because there is the stocks are issue, but fresh drugs are going to be coming in from two companies. The Mylan is producing it, but I would suggest the doctors to work on this and buy Remdesivir and keep in their hospital, because this is one single important drug which will prevent the pulmonary complication from becoming worse. Now, just a quick look at the symptoms, because in spite of having spoken several times, people are quite concerned about the symptoms. So usually there is dry cough, lot of tiredness and fever. This is the most important thing. In an ordinary flu, when you get it, you have lot of running nose and nose block. Whereas in COVID, it presents in a different way. Of course, it can present, but majority of them have fever, dry cough, and they're very tired. Less common symptoms are muscle pain, sore throat, diarrhea, eye getting infected, conjunctivitis, severe headache, loss of taste and smell. This is something which has happened in Indian population as well. And a discoloration of the finger and toes. The serious symptoms are, if you find mild shortness of breath, if you have mild chest pain, or you feel some pressure in the chest, or if you feel that you are not able to communicate properly, if a sentence is not coming continuously, these are serious symptoms. I just wanted to re-emphasize these points. Now, I wanted the homework for the day. I wanted all of you to buy this pulse oximeter. Every person who is attending this, if they do not have a pulse oximeter in the house, I request all of you to buy. To make it simple, I have actually given the phone numbers of 3 local distributors who distribute these pulse oximeters in this city. The average and approximate cost of this is between 1,500 and 2,000 rupees. What does this do? We all know we have to monitor the temperature. So fever, thermometer, but this pulse oximeter, many of us may not know. So if you see in this pulse oximeter, there is a reading called 99. 99 shows the oxygen level in the body. Then you have one number called 68, that is the pulse rate. Now, of these two, the most important thing is the oxygen saturation, the 99. So when you buy a pulse oximeter, take a notebook, put the date, and you note how much is your oxygen levels. And every day, morning and evening, you will check this. If it goes less than 95%, even without any symptoms of fever, immediately you need to get a medical consult. So this is a very important take-home message that I wanted to give. It's freely available and a single most important tool which will help us to detect if we have a small pulmonary problem and to start the treatment early. Now, today I was discussing with the specialist who treat the patients in ICU in the city of Coimbatore, and I asked them, the patients who died, what were the important points, or why is that we couldn't prevent their death? And most of them said, most of them who had died or who suffered ventilation are those people who came late. So they came late and that's why they couldn't survive. Those who came early, though they are aged, though they have diabetes, in spite of that, they survived because the treatment was started early. So ignoring symptom is like the most important culprit in this pandemic. And one of the ways to detect is to get this pulse oximeter. That's why I'm re-emphasizing this pulse oximeter as a single important tool. And if you are 99 to start with, the day it goes less than 95, immediately you will call your doctor and get a medical help. Now, why is this happening? It will look like I'm speaking to medical students, but I thought as citizens who are facing this pandemic, each one of us should know what happens. So the reason of the death which happens is because the virus affects the lung. And it's just not the lung. Normally, when you breathe in, the oxygen enters the lung, and from the lung, it goes to the blood and it purifies. So the ability of the oxygen to enter from the lung into the blood vessel, we call the pulmonary blood vessel, does not happen in the COVID patients, and that's why they need ventilator. Though they are breathing normally, the oxygen does not reach the blood. So this is the CT scan picture which shows the pulmonary, the white color, it's called pulmonary, what I've shown as on the left side is emboli. So blood clots go and form in the pulmonary vessels. It prevents the oxygen from entering from the lungs into the blood, and this is what produces problems. And now if we go early, the medications are started early, these emboli are not allowed to be formed, and that's why people survive. So that's why pulse oximeter is very important. Now the Ministry of Health has come with a new policy called home isolation. Suppose if you are found positive, should you panic? Answer is no. There is no need to panic because, as you know, out of 190 people don't have any issues. If you have the pulse oximeter and the temperature, it's enough to be in the house. So the person with mild symptoms or asymptomatic need not go to the hospital, number one. Number two, and if they have the required facilities for self-isolation inside the house, where they have a room for themselves and a bathroom, that is where you're not going to share it with anybody, that is enough. And you keep monitoring your oxygen level. Only patients suffering from immunocompromise, like patients who are cancer therapy, home isolation is not good. And home isolation is not good in elderly patients who have got uncontrolled diabetes or hypertension or heart problems. But if they're controlled diabetic, the controlled hypertension, still they can be in the house. And we should have a caregiver in the house whom we can communicate on a 24/7 basis. And the caregiver who's going to look after us if we become positive, and the close contacts in the house, the ICMR asked them to take the tablet hydroxychloroquine as a prophylaxis so that they don't get infected, or even if they get infected, it doesn't become in a severe form. So this is just to give a small note that if at all the way it is going during the pandemic, if we get infected, there is no need to get panic until your oxygen saturation drops less than 95. So when do you really feel concerned? One is when the dip is less than 95, you find difficulty in breathing, you have persistent pain or pressure in the chest, a bit of mental confusion and slurred speech, and weakness or numbness in any of the limb or face, or you're developing a bluish discoloration of the lips and the face. If this happens, when you're positive, when this happens, immediately you need to go for a medical attention. So I've tried to give you an overview of the disease and how to defeat the process of getting infected, and once you get infected, what measures you do. And for all those who are diabetic, you need to get your diabetic under strict control and HbA1c less than 7. And you need to control your pressures with timely and proper medication. If you're an asthmatic, you need to take timely nebulization and see that the wheeze is not there. If you're immunocompromised like cancer, transplant patient, long-term steroid intake, please, for heaven's sake, really isolate yourself for the next few months. And even eating food from outside, I think you should resist. People who are obese have been found to be the highest people who have had more problems needing ventilatory support. Now, what are the proven entities? There are so many drugs which have been proposed for making the health a good, the positive health. But definitive data is available with vitamin D, vitamin C, and zinc supplements. This is a strong take-home message which I would wanted to give. Proven data of this producing its effect against the virus. So even if you get infected, the lung complications do not happen and we can win over the virus. So for the prescription, I would request all of you to speak to your medical doctor. Vitamin D, vitamin C supplements vitamin D is a weekly once you take. Vitamin C and zinc supplements can be taken every day. This is an important take-home message which I would wanted to give. And whenever you're challenged, a human race has to respond with definitive give back for the challenge that you made. And the single and simple most important thing which you do, now all of us are in a state of depression because of what is happening around us, and many of us may not get good sleep. Many of us contract the disease, whether I have to get admitted, isolated, whether I have to go to the ICU. Please take away this from your mind, for heaven's sake, because if you are extremely positive and you sleep well, the best of the immunity, the interleukins or the fighters against this virus, and they are produced in abundance. They are produced in abundance during deep sleep. So by worrying and not sleeping, you are actually compromising your immunity. By sleeping well, you're going to succeed. And I would recommend that everyone should aim at having 6 to 7 hours of excellent, good, uninterrupted sleep. And I would also wish that please do not get into the habit of watching a lot of TV late into the night, sleeping late. Would wanted a strict discipline in the sleep, and I would assure you that your immunity will become multi-folds when you sleep for about 6, and the best timing is 7 to 8 hours in this pandemic to make sure the immunity is at your best. And complete belief in self that I will win over this battle, extreme inner confidence, absolute positive attitude towards life, that all the people, it has been found out with confidence, with belief, with positive attitude. The samples which have been taken in several parts of the world between people who have been extremely positive and the people who have been negative, the positive people have been found to have the best immune response. So for defeating the virus, I definitely wanted you to be positive. And I think you need to tell that even if it comes, I'm going to defeat the virus. And we have known that yoga has been extremely good, and especially the yoga where you breathe in lot of air and increase the lung capacity. This is every 10 minutes henceforth. All of us will consciously take a deep breath, hold it as much time as possible, and then release it. All the smaller parts of the lung will open up and the oxygen transmission will become better. A simple exercise to be followed with extraordinary discipline until the pandemic gets over. So yoga really helps, and deep breathing exercises really help. And to be happy always inside, positivity, inner peace and soulful music are one of the best ways to enhance our immunity. Then the next important thing is the lymphatic system in the body. The lymphatic system in the body have millions of the lymph, which is a protective mechanism against the virus. And this is another one which will promote the immunity. So I would wanted all of us to get into the mode of 20-minute exercise in the morning and 20-minute exercise in the evening to increase the lymphatic circulation. And when the lymphatic circulation works well, even if you get infected, the symptoms and the signs that you develop will be minimized. And next important thing is, when you're confined more to the house, it's also been found that a happy home and quality time with the family also enhances the positivity inside. I envisage a stage that all of us follow these small things pretty religiously to make sure that even if the virus invades us, we will defeat it. I also take this opportunity to tell you that as Rotarians and as the community leaders, we have to take steps. Now, the biggest challenge that has been posed to the healthcare system is the non-availability of adequate number of beds and the workforce which are there to look after the patient. The asymptomatic carriers do not need any medical attention. So if we remove off all the asymptomatic positive carriers away from the hospitals, the doctors can focus on people who are more sick, and more people can be treated appropriately so the death rate can be decreased. So I would strongly wish that each one of us think on these lines and make several centers available to host and hold the asymptomatic carriers who cannot self-isolate them in the houses. And leaders of big industries and companies have to create a facility within their industry to make sure that their workers are kept inside when they're in the asymptomatic stage, so that the burden on the healthcare system can reduce, and by doing this, many people can be saved. I take this opportunity to thank each one of you for being a part of this deliberations. I am extremely confident that all of us will strictly enforce a discipline in the way we sleep, the way we eat, the way we live, the way we exercise, the way we protect our homes, the way we are careful by monitoring the pulse oximeter every day. You are creating a possible scenario where your castle, your house, your organization will be protected from the enemy. And in 6 months' time, I look upon an opportunity where we defeat, and together we will have a huge congregation to celebrate our victory over this virus. And I'm sure that each one of us here will be a part of this celebration and proudly tell the human brilliance will defeat the nuances of the virus. Thank you so much. And I'm happy to answer any questions if it is there.